Hey there. I'm back for another hospital rant, and I want to talk about today how pretty much every disease that we see in a hospital has very characteristic um, drivers of those disease processes. And those drivers, major drivers of disease, are what my mentor called the four horsemen. And in this graphic, it's going to talk about what these four horsemen are: chronic, low level inflammation, catabolic physiology, which is another term for cortisol dysregulation, insulin resistance and diabetes, oxidative stress, redox imbalance. There's a patient that I admitted tonight who presented with a very common complaint, chest pain. Um, when we work up patients with chest pain or any kind of chronic disease, we want to look at what are the underlying drivers and mechanisms for why that happens. And so we're looking for, at least we can look for all three of these things. Realistically speaking, in a hospital, we're probably only looking for inflammation and insulin resistance. And the way we do that is we can look at something called an HSCRP, or a highly sensitive C-reactive protein, which is basically an indirect measure of interleukin 6, which is an inflammatory cytokine. We can also look at ESR, or erythrocyte sedimentation rate, and we can look at a hemoglobin A1C, a fasting blood sugar, as a way to look for insulin resistance. Now, are there more eloquent ways of investigating all of these processes? Absolutely. You're very likely not going to get that in-depth of a workup inside of a hospital system. You're going to have to go to an alternative practitioner, probably an integrative functional medicine practitioner, who has an interest in finding out the root causes of your disease. And you're going to have them order a battery of tests in order to find this out. Now, a good history for us should help us understand where a lot of these things are coming from, but it's good for us to quantify the amount of damage coming from what particular driver. So for example, like outside of the hospital, in addition to highly sensitive C-reactive protein, we can look at ferritin, we can look at ESR, we can look at even cytokine panels. For catabolic physiology, we can look at a Dutch test or a 4-point cortisol test, looking for dysregulation of the cortisol system. We can also look at other hormones that are affected by catabolic physiology, such as sex steroid imbalances, thyroid dysfunction. For insulin resistance, we can look at fasting insulin, in addition to A1C, or fasting blood glucose. There's also something called a glucose tolerance test, which is not commonly used at this point, at least in my practice. And then oxidative stress, there's several markers you can use. Simple things from a blood test would be like a GGT, or gamma glutamyl transferase. You can also look at oxidized LDL, or F2 isoprostones, which is a urine test you can get from Quest. And then in addition to that, there are several other oxidative stress markers, which you can get through either a Dutch test or a inorganics from Genova Diagnostics. And one of those would be 8-OHDG. There's other ones as well. There's other even oxidative stress kits that you can get from Genova. But the bottom line is, the lady that I admitted earlier, she has high level of inflammation. She has an elevated oxidative stress, index. She has insulin resistance. She's obese, and these processes are playing out behind the scenes, little to her knowledge. So I'm going to do my best to explain this to her when I go talk to her. But the bottom line is, it's kind of like the last rant I gave about being a perpetual patient. Like, you need to be looking at the drivers of disease and whether or not they are affecting you. And even though these drivers of disease can be caused by many things, aka in functional medicine what we call the root cause, or the root causes, In most cases, it is root causes, but you need to be looking at these things. You need to be asking your doctor, your provider, whoever you're seeing, to be looking for these things, to quantifying these things, tracking these things, and seeing how your different lifestyle modifications that you are partaking in, or if you're a biohacker, your biohacks, to figure out whether or not these are being negatively or positively affected, so that you know that you're not heading towards a disaster down the line. And most of these processes, take place years prior to a diagnosis, or years prior to, severe dysfunction in the body. So these are early warning systems that your body is going to be giving us to let us know that something is wrong and that a major change is needed in order to, right the course or turn the ship around. So please talk to your providers if you're not already, and get these levels checked, get these markers tracked, and start to make the necessary lifestyle changes in order to decrease your risk for getting these very common killers, such as cardiovascular disease, and potentially save your life and or those who rely on you and care for you. Until next time.